Hey everyone, Mark Luber here from Careers Out There. You can find me at careersoutthere.com. I recently interviewed Kim McAllister. She's an emergency room nurse in Northern California with over 30 years of experience in the nursing profession. You can find her at EmergiBlog.com. I asked Kim to tell us what it's like to be an ER nurse. Here's a look at how that went. Kim, tell us about being an ER nurse, specifically an ER nurse. What's a typical day for an ER nurse?
A typical day in the ER is that there is no typical day in the ER. Every day is different, and you really can't, I always say you can't appreciate a nice, quiet day in the ER until it's over, because you never know what you're going to get. But a usual day when you come in is you basically dive right in. There's no easy segue into the shift. When you come in, you walk right out into the department, into the melee that's in progress, and you get your report sort of on the fly from the nurse who you're relieving. And you just basically dive right in. And you have an assignment basically in California now with the nurse-patient ratios, that's about 3 to 4 patients, depending on the assignment. You go get report from the nurse who's relieving you, or I'm sorry, who you're relieving, and then I immediately go right in and say hi to every one of those patients just to eyeball them, what's going on, and just get an idea of where they're at immediately. And then and it sounds very simple, but for the next 8 hours, I basically am taking care of those patients, discharging, and then moving. And the whole idea of ER is patient flow. So you move the patients, you get them in, you take care of them as efficiently and as quickly as possible. Now that doesn't mean rushing. That just means making sure that the labs are done efficiently, that if they're being admitted, that they get up to their room as soon as possible. It's much more comfortable for them to be up in a regular room than sitting down on that ER gurney for very long. Discharging them as soon as possible so they can get out and get moving and the next patient can come in. So basically you're doing that for 8 hours. Of course, in the middle of all that, you've got the patients that are going to have cardiac arrests, emergent situations. I have patients that come in, with an emergency that need to be seen right away and bump the patients that have been in the waiting room. So you never know what.
So are you the one deciding if someone's coming in? Are you looking at them and saying, you're worse off than this guy over here, you're coming to the front of the line? Is it kind of like that?
The triage nurse will do that.
Okay.
And if the triage nurse says, you're coming to the front of the line and I've got the empty bed, I'm where that patient's going to go. And once that patient gets to my room, I'm responsible for doing a full physical assessment on that patient, hooking them up to the cardiac monitor so I can see their heart tracing, getting a full set of vital signs. If they're a critical patient or in a lot of pain, I'm responsible for getting in an IV so they can get pain medication. I draw blood from that. I make sure the proper tests are ordered. The blood gets to the lab. I'm responsible for monitoring those results and making sure that the physician sees the critical results. I monitor any IV fluids that are ordered on that patient. I monitor, this is really important, the patient's pain level, what it is when they come in, what it is within a half an hour to an hour after I give pain medicine. I monitor their visitors, their family, how they're reacting to the patient and how the patient's reacting to them. And what I basically look for is it's all about the patient, how they're responding to the treatments and how they respond to the eventual diagnosis. So I'm not only dealing with the patient, I'm also dealing with the family. I'm dealing with all the ancillary departments, the physicians, the pharmacists, the radiology department, the housekeepers. It's a healthcare team. And the nurse is basically the backbone of that team.
Now, you're not in a county hospital, right? You're not dealing with gunshots and gangs and violence and all the crazy stuff, right?
No, if we get any gunshots, it's rare in my facility. They'll be like walk-in. So we're not part of the knife and gun club where I work. I've mostly stayed in sort of moderate-sized community hospitals, not county trauma centers or anything like that. So the big action takes place there.
I hope this video was helpful for you guys. If you liked it, please click the thumbs up, and if you want to learn more about the career path, you could find the full interview at careersouthere.com, where we interview professionals from all kinds of career paths about what they do so we can help you find a career that fits you and you can love what you do. You can also find us at Facebook, Twitter, and lots more videos here on YouTube. Thanks again for watching, everybody. I'm Mark Luber. Look forward to seeing you again soon. Take care.